Welcome back. My name is Malik Bush, and from our last few presentations, I have discussed the topic of the healthcare worker shortage and its impact on our community. To recap, there are two main factors that are causing this shortage. First being the aging population. Baby boomers are now reaching the age of 65. What this means for us is that millions are leaving the workforce because of retirement. Also, this generation is now filling our hospitals with patients. We know with age comes chronic diseases. These chronic diseases require more specialized care, and these patients are filling our hospital. Another factor is the coronavirus. Now, this crisis has occurred for years and years, but the COVID-19 pandemic has done nothing but accelerate our problems. We're now seeing millions also leaving the workforce because they're feeling tired and burned out, and they just no longer want to do it. They have no support. So the increase in the demand for workers and the decrease in the supply of workers is what is driving our shortage. So what needs to change? We need to get out into our communities and educate people on the problems that exist. That way we can change policies and legislations that help support our healthcare workers. So remember, educate, advocate, and support. Educate. We need to get out in our communities. We really do. According to the American Health Association, 124,000 physicians are needed by the year 2033. Also, 200,000 nurses need to be hired on yearly to help meet demands. We're not just facing a shortage on that side, we're also facing a shortage on the non-clinical side in things such as administration. The non-clinical shortage is adding extra stress to those that are on the clinical side. It is now being found that over 75% of our nurses and physicians are doing tasks in which they're overly qualified to do. So, by education, we can get out and increase interest in the medical field. We can also engage the healthcare workforce with volunteers. And who knows, maybe we can get those that have retired early because of burnout and because of feeling tired to get back in the workforce and to help out. Advocate. There are many opportunities to include in legislation priorities that will help support the healthcare workforce. We need to be setting up government frameworks to help guide medical education and training and to help guide our finances. New care models, even new care models can be created to help avoid inpatient. Even new care models can be created to help avoid unnecessary inpatient and emergency room visits. It is time for those who have stakes in healthcare to implement steps to help support our healthcare workers. Also, support. The public's support is not visible at all, and the healthcare workers can feel this. So, this is your call to action. Do you remember in the beginning of the pandemic, there were billboards, people were holding up posters, and there were even signs in front of the hospital saying, "Thank you, healthcare workers. We see you and we appreciate you." This is not happening anymore. And why is this not happening anymore? Like, this is the most critical time for us to step up and support. We can also support by voting, believe it or not. We can vote for lawmakers and policies that help prioritize funding to help support our healthcare workers. And another way to support is just by word of mouth. Bring up during dinner time this national crisis. Maybe we'll have family members that'll start to volunteer at hospitals, or we can see family members starting to want to be interested in the profession of the medical field. In conclusion, the healthcare worker shortage is a national crisis that demands immediate attention. On the local level, we can get out in our communities and educate people. On the state level, we need to get out and vote. We need to get out and make policies. We need to get out and write our policymakers so that they can help support our healthcare workers. And on a national level, we need to just support our healthcare workers. Get out and make a sign. Get out and tell a healthcare worker, thank you for the amazing work that you do every day. And we're fighting on the front lines every day. Thank you. This is my list of references.